on the set, So. All right, so we're back. How's it going, everyone? It's been a long time. Welcome back to the Nurse Pod, episode 2. I guess 4. Episode 4. Wow, you know more than I do. So anyway, so we're back on another nursing topic, and no other better guest than my favorite Filipino nurse, Mr. Nurse Paul.
Yo, what's up?
Paul, kumusta, right?
Kumusta?
Kumusta?
Hi.
How are you?
Good, how are you, man?
I'm doing pretty good. Today, we want to talk about something that Paul has been discussing about me about, what are some things that we both hope to learn about while in nursing school. So before we start getting to that topic, I wanted to just kind of reintroduce you of who you are, how do we meet, and what are you currently doing in the nursing world?
Oh yeah, so my name's Paul. I met Vincent at the hospital that I still work at in Oregon. I work as a float pool nurse, so then I go through the different units just depending on which unit is like short-staffed for that shift. So whether it's like the tele unit, med surge, and then occasionally like ER, ICU. And then and Vincent was working on the tele unit back in 2020, and that's when I met him. And then found out he was from the Bay Area. So
it feels like a long time. 2020, that's like pandemic, like COVID.
Yeah.
COVID just seems like a yester thought.
Mm-hmm.
So I went to school up in Portland, Oregon, and I went to a school, Linfield University, and it was a traditional BSN program. So coming, taking all my prereq nursing classes, and then in terms of my clinical experience as a nursing student, it was, you start off as working in the SNF, started off with that, and then in terms of the specialty, moving forward to mental health, and then went to med surge, and then I did my senior practicum on a telemetry PCU floor. That was my clinical trajectory as a nursing student. And then for you actually went to was it also a traditional nursing program too as well, or?
So I went to Ohlone College in Newark, so for my ADN here in the Bay Area. So that's where I went, and then with my program, clinicals was med surge, L&D, and then towards the end of the semester it was the psychiatric facility, and then the geriatric rotation was home health visits, and then we call it preceptorship, and then I know other programs, they call it the senior practicum.
Yeah.
Where you are essentially working as a nurse, and pretty much it's all clinicals, no lecture at that point.
Gotcha.
Took that NCLEX, passed, and then when I was applying for jobs, applied in California, Oregon, Washington, and other states, and then Oregon called me back and offered the job, and then so I packed up and moved.
Nice.
And I've been there since October 2019. So it'll be 4 years.
4 years.
4 years this October.
I have a habit of leaving a job after 1 year. 4 years. So we have Nurse Paul, 4 years of experience, and we're here to give you some of our experience of things we wanted to learn during nursing school, but we didn't get a chance to, or maybe we wanted to have that particular topic elaborate more as a nursing student. So who's this video for? So this video is predominantly for nursing students and new grad nurses who have recently picked up a job at a hospital or an outpatient setting, who are kind of wanting to further that particular knowledge. So with that said, let's start talking about some of the things that we hope to learn about during our clinical rotations in nursing program. So I guess I can start with you. So what are some things that you wish you would have either tackled on, or maybe that thing wasn't discussed during your nursing program, but you later learned down the road during your nursing profession? Share a little bit about that. What are some of the things that you wish you would have learned more?
I guess the main one is how to give and receive report from the previous nurse, and then give and report to the oncoming nurse. My preceptor in nursing, so he did a great job at explaining the flow of it. Looking back, it would have helped if I actually had a piece of paper and literally have it step by step on like what to say in what order. Because at that time I didn't have an organized brain sheet to say to tell me what to say and maybe like what not to say.
Yeah.
And of course, like again, you'll hear this a lot. It comes with experience, and then you kind of develop your own style of giving and receiving reports. So again, this is strictly for when you're a brand new like nursing student or for, like fresh new grad, and how to give reports that way it's organized and you give all the important information and you receive the important information that you know, so that way you're not asking the questions that you could easily look up.
Yeah.
So for example, like what I was telling Vincent was, when you're giving a report, it would be something like, all right, room 1 is Vincent. He's a 30-year-old male. He's a full code. He was admitted on February 30. Yo, cut that. February 22nd for shortness of breath.
It was on a leap year.
It was a leap year. Admitted for shortness of breath for asthma exacerbation.
Okay.
And he is getting nebulizer treatments and an inhaler. He is alert and oriented ×4. He is independent in the room, so he can go up to the bathroom. He is not on a telemonitor. He is on 2 liters of oxygen, but his baseline is room air. And he has an IV in his left forearm and it's signaling locked. And he doesn't have any skin issues. That's typically what I feel is the best way to give report for a typical like med-surg patient. And then of course, if you're in like specialties like ICU, you will include a little bit more information, especially because they'll have a lot more going on. Saying that what the patient was admitted for, what the treatment plan is, how alert they are, and how they get out of bed and like around the unit are, I would say, like the 4 important ones to mention. Because like if a bed alarm goes off, you go into the room and the patient says they need to go to the bathroom, but you don't know if it's safe for them to just go with a walker or if you actually like physically need to hold them. So I feel like those are the questions that you should ask when receiving a report from the nurse.
Yeah.
Because the thing that I noticed about myself when I was new was I felt like I had to ask just any question rather than just saying like, oh, okay, like, get a report and like not say anything. In the example that I gave about like a patient coming in for asthma exacerbation, when their last bowel, like asking when the last bowel movement one isn't important. Of course, I wouldn't be rude about it if a new nurse or whoever asked. But the reason why like that isn't an appropriate question at that time is it doesn't affect the plan of care. That's not why they're in the hospital. So just keeping in mind what questions are appropriate and not appropriate at the time to ask.
So it sounds like it's very very situational, right? But in situational, I mean like depending on what the patient is coming for, what their diagnosis is, right? Like you're not going to ask a patient who's coming in for a chest pain that was recently admitted on the hospital on the shift that you're working on and ask about their bowel movement. But if it's something pertaining about a surgical procedure, you try to have those related questions.
Yeah.
And also the kind of like the report you're giving. So that's predominantly, it sounds like for medical surgical patients. And then you mentioned in the ICU, you'll be a little bit more kind of more descriptive in some of those questions that you ask.
Mm-hmm.
What would a question or what would a report sound like in the ER? I know things are a little bit quicker turnover. So let's say if a new nurse or a nursing student is actually interested in working in the ER, what does that report look or sound like? So let's use me as an example. So Vincent, a 30-plus-year-old man admitted on February 30th, right? Like just came into the AR for something. Let's make up a scenario. What would that sound like?
Oh wait, and what was your complaint again?
So
chest pain.
I haven't pooped in 2 days, or a constipation.
Oh, constipation. Oh, okay, yeah. Yeah. So we'll just say like room 2 is Vincent, 30-year-old male. He's been complaining of abdominal pain. He says he's been constipated for like 5 days. He doesn't take any stool softeners or laxatives. We gave him stool softeners and laxatives, and he'll get a CT of his abdomen. Pretty much like, oh yeah, and then it'll say, yeah, he's alert. He could walk in the room.
Nice.
Yeah.
I got a free diagnosis, so that's actually what's happening right now.
And then, or like, I guess another easy example would be if someone came in for chest pain. Again, Vincent, 30 male, came in with chest pain. We did the EKG, we put an IV in and drew his labs. We're just waiting for results.
Yeah.
That's pretty much it.
That's pretty much it.
He could walk, he could talk.
No skin checks, if not really required. Like I'm not having any type of trauma or any stab wounds or anything. I'm just coming in for a chest pain. So it almost sounds like it's a very focused assessment, right? Did you ever find yourself in a situation where, I don't know if it's just me, but let's say something emergent happened during your shift and you haven't had time to memorize your shift report or like your brain sheet, what you're gonna do? Obviously, like your turnover report would sound much more succinct towards the end of your shift because you spend more time with the patient. You've seen their trajectory, their progressiveness in the unit that you worked. But let's say if a patient just suddenly had a code blue, right? And then like you have to give a report to a physician or to a charge nurse or to whoever's coming in to intervene. Let's say somebody who is new, who is already like starting to figure out how to give a report towards the end of the shift. But what are some tips you think you can give to newer nurses or nursing students who unfortunately catch themselves in the event of like a cardiac event or a code blue? How would they
give report?
How would they give report in the very small amount of time that they were working with this patient, right? Let's say 3 hours in, this patient just coded.
Well, yeah, whether it's a rapid response or like a code blue, in an emergency situation, like your room's gonna get flooded with people, but as you really just tell them what the admitting diagnosis is and a brief of what happened. Like, so for example, you can say, yeah, patient came in with chest pain, entered the room, I'm just taking their vitals, and then all of a sudden they passed out. I tried waking them up, they weren't responding, so I called a code blue.
Yeah.
That's pretty much, yeah.
So it sounds like just SBAR.
Yeah, it is the SBAR, why they're here,
Yeah.
and then what happened before you called the rapid response or code blue.
Right.
And of course, like you could have your brain sheet, and then you're in the patient's room, so you could open up their chart, assuming the facility that you work at has a computer in the room. Sometimes the hospitalist who admitted the patient is there, so they'll have they're more familiar with the patient, but you can just straight up tell them like, this is what happened prior to me calling the code.
Yeah. Another thing I can even add on to that is it almost feels like, when you're first starting out, it feels like you don't have time to prepare for an emergent event like that. Like you don't have time to kind of gather your thoughts to create this very comprehensive report to a patient, let's say, who coded 3 hours ago. But as you start to work and gain a little bit more experience, I think you can kind of see who is pretty much decompensating. So that's when your prioritization skill kicks in, right? And again, this isn't just like a solo effort on your own. It's a collective interdisciplinary collaboration, right? I would hope that the nurse who is giving your report when you're coming in to work your shift is telling you, keep an eye on this patient. And so when you hear that, you automatically know that like, okay, maybe this is the patient out of my 4 or 5 patients that you're scheduled to work with. Maybe this is the patient I need to spend more time with, more attention with. Maybe I need to pull up their reports, their doctor notes a little bit longer than some of the other patients who appear to be more stable. So I would say definitely focus on that patient more, while also making sure that all your other patients are like safe too as well. But I think for me, what I had to learn the hard way. I remember like I was working with a patient who appeared to be somewhat stable, but end up having to call a code blue. And then during the moment of panic, obviously I wasn't able to give a succinct report to the patient. I actually had to look at my charge nurse, hoping that they were able to do their homework better than I did, hoping that they would answer for me. Obviously, I was new at this, and we did a debrief at the end too. So we kind of focused on areas that I could have worked on, right? So we came up with a plan that if something like this happened, what could I have done before? And one thing she said was like, based on the 4 or 5 patients you have an idea of which patient is heading who's going to need more time and attention because their diagnosis is a lot more acute than the others, and if so, like start pulling up more background information about that too as well. And another thing I would also add is like, don't wait till the very last minute to chart. I know in a perfect utopian clinical setting, like we can all chart in real time, but if you have a moment to breathe, definitely chart in real time as much as possible. You don't have to wait till the end of the minute to like gather your thoughts in case of something like this happening. Prioritization, make sure you chart on time. Hopefully, you know, the person who's giving you a report is kind of giving you clues on which patient to keep an eye on. Another thing that I like to do for Brainsheet is, depending on what electronic medical records you use, I know we use Epic, that's like our favorite software to use. In Epic, it gives you kind of like an hourly flow of what you should do from this time to this time for a patient. For me, I'm not always on a laptop when I'm in the patient's room, you know, because I'm there with the patient, or like when I'm walking from hallway to another room, I don't have a laptop with me available. So what I like to do on my Brainsheet is first of all, I have a lot of paper on hand. I know you have a very short way to create a Brainsheet. Like you just have 1 or 2 paper. Sometimes I end up with like 4 or 5 papers. But I'm a visual learner. So if you're a visual learner or if you're a kinesthetic learner, what I like to do is I like to draw out, like, okay, I come into shift at 700 hours, then 800 hours, 900 hours, 1000 hours, you know, for day shift, right? And then all the way through 12 hours, right? So each hour for that patient, I'll write like at 9 o'clock, they're gonna get their, you know, gabapentin, they're gonna get their insulin, they're gonna get this. And then at this hour, I'll check their blood sugar at this hour. So I'm visually writing out everything so that I can kind of ingrain in my mind what I'm expected to do. And as you get comfortable, you can kind of see the pattern of what you're expected to do for patients of this specific diagnosis, right? But if you're starting new, I definitely recommend mapping that out. Also, if you're not used to military time, right?
Oh yeah, like switch everything, like your watches and your phones, to the 24-hour format. Like even prior to like starting nursing school, or if you're interested in any sort of like medical field whatsoever, it makes things easier in the long run because you're already used to it. And also because in terms of like documentation, things like that, you'll see it so often because communication is important, and it would be unfortunate if your paper said you wrote 6 a.m. but it was supposed to be 6 p.m. maybe because you wrote it differently or what have you. So like putting everything in a 24-hour format or military time is like beneficial.
So you know how you were mentioning about like, don't ask questions just to ask questions, right? Like don't ask about their last bowel movement if a patient's coming in for a chest pain. Like, again, you'll start to know that some of the things may be irrelevant based on work experience. But is there any certain questions that you can ask that is always like on the spot? Like, that's actually a good question to ask. Can you tell me some of those questions?
Yeah, so for sure, because again, every nurse kind of gives report differently. Some nurses give report better than others. When it comes to asking questions, I would say the main ones to ask if they weren't given in report are, how alert is the patient? Like, are they completely with it? Are they slightly confused or completely confused? How do they move around the room? So are they independent? Are they a standby assist, meaning you just have to walk by them? Or do they just use a walker? Another one would be like, you know, how does the patient take their medications? Like, do they need them to be crushed and placed in like applesauce or pudding, or can they take them whole? But that one's mainly for if the patient is confused, if they had a stroke or have like any sort of swallowing issues, things like that.
Yeah.
And again, like, you know, going back to, you'll know which questions to ask, which ones not to ask with experience. I mean, like, don't get me wrong, like, I definitely asked when was the patient's last bowel movement. Again, because like I was so nervous, like I felt like I had to ask a question just so I'm not standing there like silent. But yeah, I at least wanted to like, give you guys an idea of what questions are good and why, which ones are not appropriate and why.
Yeah.
What is the admitting diagnosis? And then what is that plan of care for that diagnosis? Especially if, again, like myself, if you're float pool, or if you haven't worked with a specific diagnosis before. just so you have an idea, especially like, because like some people, they float to different units because their home unit is well staffed, another unit isn't. So yeah, things like that.
Yeah, I felt like I definitely asked that. When was your last bowel movement? Because it was just, I mean, okay, so I was a nursing student and I wanted senpai to notice me, right? So I wanted my preceptor nurse to like, don't think I was a mute nursing student who didn't like to ask. But yeah, I couldn't think of any other questions. And I think for some reason in class, we were talking about bowel movement and that popped in my mind. And I asked like, hey, when was your last bowel movement? And I'm pretty sure I got some weird internal looks. It's like, is this guy for real? It's like, but you know, again, like I would just encourage you to ask questions. Like even if it feels silly, like the end of the day is you want to make sure that the patient is safe. And sometimes it will require a little bit of courage to ask silly questions, which in my honesty, I don't think they're silly questions. I think it's a very unique way of you learning.
Yeah.
Right. So just ask, be active. You're not going to know everything. And when you start off, it's going to be awkward, you know, but that's just like doing a new skill or becoming a new version of yourself. It's going to be hard. But I would say always ask. I would be more fearful if the person I'm working with does not ask, because they're potentially kind of like a potential risk, right?
Yeah.
So ask away. Don't be ashamed.
Oh, and another thing I was going to mention, like when you're giving a report too, if it's attached to the patient, mention that. So if they have an oxygen if they are on oxygen, if they have the telemonitor, if they have like a feeding tube, like an NG tube, if they have a Foley catheter, whatever's attached to the patient, mention it. And again, like when you're giving a report, you know, you're not going to give out this detailed novel of who the patient is, but whatever's attached, mention it, because it would be awkward for the oncoming nurse to be like, I didn't know you had this.
Yeah.
You know.
So kind of so back to giving bedside report, working down on your system. And again, I highly advocate bedside reporting by the bedside, because maybe the nurse who's giving the report may not mention an NG tube or you know, a nasal cannula, but you're in the room, you can also see it too. Again, you know, like we're not going to be very perfect with our nursing report. I think like giving bedside report at the bed is highly encouraged. I recommend new nurses do that. I recommend all nurses to do that, right? It gives you an extra opportunity to see what the patient looks like in case of the ongoing nurse forgets to give a little bit of tidbit about that, but at least you can see it in your own eyes, and maybe that might remind the nurse, oh yeah, I forgot to mention that. There is a nasal cannula. So I think, yeah, that's a good advice. Let's talk a little bit about just like clinical experience, and it doesn't have to be clinical experience specifically in the hospital. It could be during clinical labs. So
like skills labs.
Yeah, like skill labs. So don't be expected to do everything in a work setting. If you learn only an hour or less putting on an NG tube, don't be expected to be a professional of putting NG tubes right after nursing school. That's what residency programs are. You know, that's what orientation is for, right? That's what your coworker is for. You know, somebody who's working there a lot longer, they can be your teacher. We have clinical educators in outpatient or inpatient settings who do like these annual competency checklists that you can focus on. So don't feel pressured or anxious or like I'm losing out my mind if I only learned this one particular skill set in a school setting for like 10 minutes and now I'm expected to be an expert in that. That is never the case. I would say the most important thing is knowing who is your point of contact for that specific skill or specialty that you are struggling with, right? So
yeah. And I feel also in general, even if you, with almost like any skill, whether it is putting a Foley or an NG tube, or even like simple stuff like, I would say like drawing up a vaccine, I actually ask, like sometimes I'll still ask questions that are quote unquote, oh, something you should have learned in like nursing school, mainly because nursing programs are different, and like how some nursing programs actually don't let you do IVs.
Yeah. And
my rationale behind like asking all my questions is if the way Vincent explains things better than the way I've been explaining it to patients, I'm going to start using Vincent's explanation. Again, because whether it's with your colleagues or even with the patients, you can have like all the knowledge in the world, but if the way you're explaining it doesn't really make sense or doesn't make it easy for the other person to understand, how useful is that knowledge in the first place, you know? So again, like, you know, with all the years of experience that I have, I ask questions from everyone, like the students, the new grads, even CNAs, older nurses, to help improve whatever I'm doing, to see if there's like a more efficient way of doing things. Like when I first started and I'm helping my CNAs help change a patient, I ask the CNAs like how to line up like the brief or the chucks pads underneath, so that way it's not too high up or too high down on the patient. And it got to the point where other CNAs ask me if I've been a CNA before, and I take that as a compliment because they, you know, they're saying like how helpful I am, or like, and how the way I'm doing things, it most likely looks like how they would do things.
Yeah. So that's another thing that I wish I was taught in nursing school, is to always ask for help or even shadow ancillary workers, right? CNAs, medical assistant if you work in a clinic outpatient setting, phlebotomy, I think is great too. You can kind of...
Oh yeah, I ask the phlebs questions too.
Exactly, like you can kind of expect what type of labs to draw. Again, it's very unit based, but I would say if you're working in a hospital, definitely take the time to work alongside with CNAs. Respiratory therapist is also another great option too as well. PT, and then you have speech too. If you're working with patients who had some type of trauma, stroke, things of that sort is another good. I mean, the idea why you want to work with so many different medical staff is because as a nurse, you're sort of in the center. You're like the center hub, and you are the point of care for that patient, right? The doctor is going to come and talk to you. The RT is going to talk to you. The CNAs, all these different, you know, ancillary workers are going to come to you for questions, right? So I think it helps to create a stronger interdisciplinary team when you kind of know a little bit of what each and everybody does, right? You can kind of ask them the right questions so that, you know, when it comes to giving a report to either the oncoming nurse or giving a report to the physician or to the charge nurse or whoever, you get a little bit of tidbits of information from different scopes of practices, right? It gives you a better picture of what the patient is going through. Definitely highly encourage that too if you have an option in your clinical experience at a hospital or wherever to maybe spend a couple minutes or an hour working with that particular staff. So yeah, that's a good one. So I definitely recommend like any moment in your shift, in your precepting, in your senior practicum, any moment that you feel like you had a light bulb in your head, write it down, journal it, you know? It definitely makes applying for a job a lot easier because you already have all the stories documented, recorded it. You manifest that, you know, from here into words. So write that all down. So we talked about, you know, using a teaching moment or like a light bulb moment during your clinical experience as a potential answer for a job interview. Now I want to segue into talking about how to look for those jobs, right? That I wish that nursing program would have taught me. And I've learned this through my own way, and I also learned it by reaching out to other nurses when I was in nursing school too. And one of the things I've been using a lot more so recently is using LinkedIn, okay? So for those of you who don't know what LinkedIn is, it's a kind of like a social media, professional social media. It was like basically like Facebook in 2004, 2005, right? Without all the ads and stuff. So the way that I use LinkedIn is I use it for job postings, right? Because sometimes hearing whether an event for a job posting at a hospital, that information doesn't get to me quicker than it does through LinkedIn because thing tends to, I mean, I'm on my phone, I'm on the laptop, so I get these information a lot quicker. So using LinkedIn, looking at the job posting helps too as well. You can also use LinkedIn to kind of network with other nurses, nurse managers, recruiters too, right, in your local area. I think that's a great resources to utilize. When you're creating a resume, a lot of people don't tell me, when I applied to like over like my God, it was like 60 hospitals in the state of California as a new nurse, and I got 0, right? It's not because my resume was whack. It was because I wasn't using the right keyword. So you can use LinkedIn to see what the job posting are, and you can see what some of those keywords are, and then you can try to curate your resume to fit those certain keywords. And that is called the automatic tracking system, the ATS, right? And there's different types of sites that can compare your resume with the job posting, and they'll kind of feed it through an algorithm, and it churns out a percentage to see how much of your resume matches with the job posting. And unfortunately, a lot of facilities, they use an algorithm system to kind of filter your resume first before it gets into the eyes of a human being, right? And you know, that doesn't discredit you as like a horrible potential nurse. It just means that, you know, now we live in a society where information is going through a lot quicker, and we need to be more efficient, so they feed into this middleman of an algorithm, right? So definitely use those as a resources too when you're applying for jobs, just to kind of get you a step ahead than some of the other applicants too as well. So do you got anything to add to that?
No, I think you've like pretty covered it, especially because like I believe you said you're currently searching.
I'm applying for work.
Okay, I wasn't sure if I was allowed to say that. Yeah, so like, you know, I'm still working on my job, so I'm not actively looking. So in terms of like setting up my resume and like how to practice for an interview, like I would say I'm rusty at that. Like until that time comes, then that's when I would be like taking this advice into account and like reaching out to you.
So if you're applying to the same job I am, don't take any of my advice. No, I'm just kidding. No, take my advice. I think that definitely helps too. Like, I think it's different because, like, you know, I live in the Bay Area, so like it's saturated with nurses. You live up in Oregon. I don't know what the job market is like for you right now. Again, I mean, do your own research too. But I think for me, I had to approach it differently because, you know, at the end of the day, I'm just a numbers game. And in order for me to be seen, I need to kind of understand how the application process works. So use LinkedIn, you know, definitely look at Indeed, look at Glassdoor, check out the reviews, check out how much these salaries are. I know when I was a new grad nurse, I didn't really have much choice because I just needed to get my foot in the door. So, you know, that's also a potential too, is like understand that you may be limited on how much you can negotiate, how much you can leverage yourself because you're new. But if once you get a year of hospital experience or whatever you choose to work at, definitely take some of these advice into consideration to kind of get you a step further and getting you into the hands of a nurse manager or whatever. Let's talk about, like, it's your first day on clinical in a med surg floor. What are some things you advise nurses or nursing students to bring?
Oh yeah.
What's in my bag?
What's in my
What's in my bag?
So for sure, you especially as a nursing student, bring your stethoscope because. Let's
talk about stethoscope, okay? As a cardiac nurse, I like to talk about stethoscope.
Talk to him.
Okay, I'm gonna tell you what's a good stethoscope. You don't have to spend. Was that the cardiology?
We're talking about
the Littman cardiology 3 or 4, or no, the 4. So I have the 4, but I didn't need that. I'm gonna be with you. I don't need that. You're fine with just getting a 3. Just get a 3. It's $100 cheaper, and you'll hear. I made a separate video on this to choose what's the right stethoscope. But I say if you're a nursing student, just get the bare bone. You know, train your ear before you start to get the bigger stuff, right? Sorry, go ahead.
Oh yeah, for sure your stethoscope because you're not gonna do clinicals without it. Pen, you know, for taking a report, and then the stuff that I recommend afterwards, especially if you're like working, is like a Sharpie.
Yes.
A pen light, and then a whiteboard marker.
Yeah.
And then the stuff that you could pick up at work are flushes and then the alcohol wipes.
Okay.
Because like with the Sharpie, I mainly use it for, like, if I'm like labs, or if a patient has like wound care and I'm writing on the dressing to write like the date and time it was done, things like that.
Like a lidocaine patch, you'll write it down. Yeah.
Yeah, and then with the pen light, even like, because I use the pen light even not on like the tele unit, because primarily when people think of pen light, it's for checking the pupils for like a stroke patient.
Yeah.
But I've used it if patients would say like, oh yeah, like I have a rash or whatever in my mouth, I'll just shine my light in.
I shine it on my coworkers just sleeping at night.
Yeah.
It's like it's like a
Like
compliment.
security. No, yeah, like it's very universal. Like, I mean, you could pull out your phone if you want to do that.
Yeah, but I think the phone thing made me look unprofessional because
Yeah.
they might think you're on their phone.
Yeah.
But yeah, you're right. You can use your phone too.
But yeah, stethoscope, pen light, Sharpie, whiteboard marker, and then at work you'll pick up the flushes and the alcohol wipes.
Yeah. And then Miralax.
Yeah, Miralax.
No, that's good. So, yeah. So the advice is like on the stethoscope, you don't need to spend a lot of money on stethoscope. I know people want to be cute and they have like, oh, the cool stethoscope, the colorful one. Some of them get like the what is it, the echo stethoscope, the one that can like record. Like, no, don't get that.
Oh, that's hella. Yeah, that's hella expensive.
You don't need that, like, unless you work in a cardiology clinic or if you're a cardiologist. But if you're working on a tele floor, you don't need to do that. It's way overboard, and honestly, save that money on a trip to like the Caribbean or something. What can new nurses or nursing students do to manage their anxiety and their stress?
So going back, so again, my nursing program was Ohlone College in Newark, and they were big on like mental health and self-care. That's what I really loved about my program.
Nice.
That it was actually one of our homework assignments where we actually had a log. You put the date and time, the activity you did for self-care, and how much like time you spent on it. And yeah, like I prioritize self-care and mental health a lot, even at work. And in terms of how to manage it on shift, it really is just like slowing down, take a deep breath, and think, okay, what do I need to do at this moment? Because it's easy to go down like a rabbit hole of thoughts of, okay, what if this happens, this happens, this happens? So whatever is happening at the moment, what do you need to do that's going to help the patient or get them on the right track to get helped?
Yeah.
And then, like, yeah, just like finding a group of people that you trust to like vent and be open with.
I know we have happy hours in the morning.
Yeah.
It's just orange juice and
just orange juice.
Yeah. No, that's good. So
and also going back to like that thing that I mentioned earlier about like journaling, whether it was like a good moment or a bad moment, because you could always turn the bad moments into a learning and teaching moment.
Yeah.
So that also helps. Because I've definitely done that plenty of times where in hindsight, I'm like, oh, how come I didn't do this sooner?
Mm-hmm.
And then again, just like writing it down and then writing the event. And then at the end of me summarizing what the event was, I have a section where it's like, what to do differently next time.
Okay. I think for me, when I was a nurse, I mean, even till today actually, but like more so when I was a student and a new nurse, I think I created this like certain expectations so high that if I don't do this one particular expectations and when that thing is not met, I take it personally. Like to myself, like, oh, like I start to create like these self-limiting belief of who I am. Like, oh, I'm not capable of doing this because I forgot to like flush the IV, or I forgot to, give a patient a warm blanket or something like that. Just something like that, right? Like I took the task very seriously, which is great, but it also kind of like took a mental health on my self-esteem too as well. So I think one thing I need to tell myself is don't take it personally. One of my professors, who's now a dean at my nursing school, the one thing he told me that I remember to today is Q-tip: quit taking it personally, right? So whether you're getting a feedback from a physician, from a charge nurse, from your preceptor, take this as a learning lesson. Don't take it as a personal attack against your value as a nurse, right? Because you're gonna make a lot of mistakes, right? Whether you believe it or not. But take these mistakes as a learning opportunity. Also understand that you're not gonna know everything, especially coming in as a student, and then especially coming as a new nurse. Even I till today, like I would pull up a policy and be like, how did I do this thing again, right? Like, understand that like things are always constantly changing. I knew when we worked in COVID, like the policies was constantly changing every so often, right? Like, do I wear a PPE only in this room? Oh, now we can wear it in 2 different rooms? Oh wait, what? So, you have to be very flexible. Be able to learn to like roll with the punches, be on your feet, be willing to understand that like the medical world is always constantly evolving. Also, another stress management thing is if you can, find something to do outside of nursing. I know you're into like bike riding, right? You just recently did the Tour de France.
Yeah. Yeah, I biked from like Campbell, San Jose to LA last September.
How many miles is that? You tell them.
I think we recorded for 440 miles.
Is that like Tour de France? I don't know how much is that. That's like,
I honestly don't know.
Okay, it's long. It's long. Yeah. So biking. Yeah. So do something. Find something outside, like Muay Thai. Do Muay Thai. Join a Muay Thai gym. I can recommend to do Muay Thai. Do rock climbing. Whatever it is that like soothe your soul and get you kind of out of like nursing for a bit. I know like as a new nurse, like all I ever wanted to be was a nurse, and I identified my entire identity as a nurse. Like I would go out and like, if there's any conversation, if there's any opportunity to tell people that I was a nurse, I would tell them I'm a nurse, right? I even have my car RN sticker on the back of my car. Now I regret having it on my car because if anything happens, I'm obligated to do that. Like if I'm on a plane and if something happens on the plane, it's like, is there a nurse on board? Like I will be the first one to slowly hide myself away. But jokes aside, I say this because like, as new nurses, we spend a lot of time, investing in our education. We put our sweat, blood, and tears into like acing our tests, doing well, getting high remarks in the clinical, getting feedback from, a preceptor, and then when we finish nursing school and we finally land our first job, our first thing to do is like, we want to put our best, best feet in the door, right? Like to be the shite and briny nurse ever. But sometimes when we hold ourselves too highly like that, and then when we make that one mistake, we take it so personal, and then everything starts snowballing down. So the best way that we find that kind of helps us separate from that identity is to understand that like at the end of the day, you're more than just a nurse. You're many things, right? You're a Tour de France bike rider, you're a Muay Thai professional fighter, you're more than just you're more than just the sums of your part, right? So closing statement, if there's anything that you think we missed, or if there's anything that you want to share or provide any tips or things that you hope that you want to learn as a nursing student, feel free to leave a comment in the comment section, and I'll try my best to kind of get back to it. Paul, thanks so much for being on the show. It's been, 2 years since I've seen your face?
Has it? I think it's maybe 2 years since the video.
I don't know, I guess I just missed you. It's been a long time. Yeah, he's my favorite Filipino nurses. And that says a lot. I know a lot of Filipino nurses. So, but yeah, thanks for coming here and sharing your wisdom. This has been such a great learning experience for me, and it helps to kind of like made me think about what it was like starting as a nurse. And I'm like really excited to see like these new wave of generations of nurses being part of the workforce. So thank you for what you do. And other than that, this is V and Paul, and we're signing off. Peace. Take care. Bye.